हाँ आपका फोटो लगा है। अभी क्वेश्चन यस। हाँ बात करें।
हेलो। हेलो।
सुनाई दे रहा है आप? जो
सुनाई दे रहा
चेक
है?
कर सकते हैं।
ओके।
यस यस।
ओके। So, हेलो, नमस्कार। रिस्पेक्टेड चेयरपर्सन सर जैन देव पुजारी जी, प्रेसिडेंट बोर्ड ऑफ आयुर्वेदा डॉक्टर श्रीनिवास प्रसाद जी, प्रेसिडेंट बोर्ड ऑफ यूनानी सिद्धा सोमारिपा डॉक्टर के जगन्नाथन जी, प्रेसिडेंट एमईआरबी डॉक्टर रघुराम भट्ट जी, प्रेसिडेंट बोर्ड ऑफ इथिक्स एंड रजिस्ट्रेशन respected Dr. Rakesh Sharma ji, members of the different boards, Dr. Atul ji, Dr. Dwivedi ji, Dr. Madhu Kumar, my colleague Dr. Aarti ji, Dr. Susu Knojiya ji, Dr. Putri ji, Dr. Nayan Jadhav, Dr. Rajini Nayak, Dr. Alam, learned participants, and dear students. It gives me immense pleasure to welcome you all in this series of lecture to celebrate the fourth Foundation Day of NCSM. Though the Foundation Day shall be celebrated on 11th June 24, but this series of lectures to make aware of the stakeholder regarding various initiatives, activities, and vision of different board has been started from 3rd June 24. As you are aware that first online presentation was given by Dr. Prasad ji on 3rd June about the reforms in ASUS education, followed by Dr. K. Jagannathan ji on 5th June regarding his board activities and reforms in ASUS, particularly Unani Siddha Savaripa education. Assessment of the college institute in relation to MS requirement and to establish new ASUS institution or to increase the UG seats or increase the PG seat or starting PG colleges and rating of various institutes was given by me and my colleague Dr. Aarti respectively in the absence of our president or Dr. Raghuram Bhatt ji due to his health issue. Thank God he has now joined the office and present here. Lastly, President Board of Ethics and Registration, respected Dr. Rakesh Sharma, presented the activities and work done in his board in very elaborative manner to make the practitioner of ASU as aware of their rights, conduct, and ethics. Similarly, his board members, Dr. Putri ji, Dr. Jadhav ji, Dr. Rajin Nair also made their presentation in relation to their board. In continuation of this series of lecture, today our honorable chairman sir in the morning session took a lecture on very important topic related with the students, particularly the UG students, how to learn Ayurveda in UG. And just now we'll start with the similar type of lecture, but this lecture is for the PG students. So this topic is very near to his heart, and most of the occasion, whenever he gets the chance, he used to discuss this topic with the students. Whether Jain Dev Pujari need no introduction, as all of you know about him. But I'm duty bound to say a few words. Pujari sir is graduated from the Nagpur University. Then he did PhD in Kayaksa from University of Pune. He has vast experience, more than 35 years as a Ayurvedic physician, practitioner, uh, and researcher. Presently, he is holding the charge of Chairman, National Commission for Indian System of Medicine. Prior to this, he was the Chairman Board of Governors, CCISM, New Delhi, and was also elected member of the CCISM. Being the chairman of this commission, he is also a member of the advisory committee Ministry of Vice and member Ayurveda Training Accreditation Board, Rashtriya Ayurveda Vidyapith Ministry of Vice. He is also a member of the Society of NIA, that's the deemed university, Jaipur. He is having so many achievements, like he is awarded this DLIT in 2020. In 2022, he is awarded this Dhanvantri Samman and so many other awards during his career. His, he has so many publications and patents on his name, particularly this publication of Gandh Shastra, Bharatiya Ahar Shastra, Mathematics in Ayurveda, Ayurveda Education Perspective and Implication, Madhumeh Parche, Dietetics in Sanskrit Literature, Minds in Sanskrit Literature, and so on. So if I go through the biodata, then it will take so much of your valuable time. So he's known for his innovative ideas. Under his leadership, the commission brought drastic changes and reforms in ASU education, and also for the welfare of the practitioner. He is not only leader of the commission, but he has a very innovative idea and envision the NCSM as a world leader in ASUS education and major healthcare provider at pan-India level. For this, he has made attempts to establish Center of Par Excellence for Continuous Teacher Training, developing and implementation of ASU specific teaching and training methods, inculcating modern teaching and training technology to teach medical system of India, incorporating Indian thought process in ASU as education, incorporating modern advances in ASU education, and by creating dynamic curriculum to synchronize with the national and global needs. So, with this small introduction, I would like to add some few words. He is not only the leader of this commission, but having in-depth knowledge of subject of ASU, all the system of related to Ayurveda, Siddha, Unani, Sovarepa. He is a very good research. He is having a research-oriented mind, expert in legal matters, and above all, noble, humble, down-to-earth, and well-behaved personality, which is leading this commission. Not taking much of your time, I invite Vaidya Jain Dev Pujari ji to address the participants, particularly now the PG students. Thank you, one and all. Now it's over to our chairman, sir, respected chairman, sir, Vaidya Jain Dev Pujari.
Namaskar to everybody. Am I audible, sir?
Yes, audible, sir.
Thank you very much. Thank you very much for a very nice introduction, second time. And respected all presidents of all boards who are present over here. Similarly, respected members of all boards who are present over here. And my friends, and I am seeing here a few principals of you Ayurveda College, they are running postgraduate studies, etc. So, welcome to all. And in the morning session, I talked with the UG student. And here I want to speak to the PG student regarding their studies, how to study, etc. So, here is a small presentation for you. So, how to study for Indian system of medicine, master's degree. This is actually the heading. So, Now, getting into the master degree of Indian system of medicine is not an easy job. You have to crack the examination or India entrance examination, and with the tough competition, you enter into this. Now, what next? So, next slide, please. So, now welcome to post-graduation in ISM. Please look into this picture very carefully. Now the olden days have gone. Though our Indian system of medicine, they are traditional and they are very old. But now we are in the era of the technology, and all our life is invaded, pervaded by the technology, and our education, our practice is not exception to this. So that's why, even though we are going to become a practitioner or a teacher or a researcher of Indian system of medicine, to maintain our concurrence, our consistency with the time, you have to go with the technology, and that's why I have put this particular picture, and this I have shown to UG students also. Next. So why masters? This you must be well aware, but just to start with the subject, this is the question. We can answer this in 4 ways. It is ideal for those who want to study a particular subject in a greater detail. Because at UG level, we are studying many things at a time, and basically UG education is to make you a general practitioner.
सर जरा पास होके बोलिए
A general,
पास होके बोलिए
now it is audible.
यस सर यस
So it is ideal for those who want to study a particular subject in a greater detail, because during undergraduation we come across with many subjects, and we feel that yes, I like particularly this subject, like say in Ayurveda, Rasa Shastra or Dravya Gun or Kaya Chikitsa or Roganism, whatever it may be. It makes you a specialist. Once you now our regulation is coming, post graduation regulation is coming. There it is defined with the each subject that if a person is postgraduate in that particular subject, then he is specialist of what all things from that subject. It makes you to experience how to do research, because during your dissertation work, basically dissertation work is that it will come again. Dissertation work is to teach you how to do research, not to do research. How to do research is more important, and it helps to improve your employment opportunities. It is very obvious that at many places post graduation degree is mandatory. Like teaching, if you want to go for a teaching, then post graduation degree is mandatory. For research, post graduation degree is mandatory, and at many places post graduation degree is mandatory. So it helps to improve your employment opportunities. Next. So why you are here in a particular subject? Due to marks. This is primary, as I told you, because we enter through an entrance examination. So due to marks is the primary thing, and due to liking is secondary. So sometimes we may like Kaya Chikitsa, but because of mark we get Rasa Shastra. It is okay, but we have some liking with this. Next. So do you know your aptitude? Do you know what aptitude is? Aptitude is what you are fit for, basically by nature. That is your aptitude. So here, scientifically, people have studied many things regarding the aptitude, and they have grouped aptitude in the different categories. Next. Basically, what is aptitude? It is a natural ability to learn something. Some student, not from our field or maybe from our field, they are more interested in the instrumentation. They go out, they try to develop the Nadi Yantra, they try to improve the Panchakarma procedure instrument, or they try to improve even the working of their whatever small things are there. It is an inclination where you are naturally inclined, and it implies a natural liking for some activity, and the likelihood of success in it is most important. If you have a natural liking for some activity, then the possibility or likelihood of success increases manifold. If somebody is a very good teacher and he became a teacher, then he naturally is intended to become a very successful teacher with a fan follow-up of his student like anything. If he is a naturally liking for a practice, he is a practitioner, then he is going to become a successful practitioner. It is very obvious. If someone is administrator, it is very obvious that he will be succeed in running an institution or an organization. It is very clear. So this is actually what aptitude is. It is your natural ability to learn something. It is your inclination, natural inclination, which is there in your, you can say, genes. So next, these are the types of aptitude: logical aptitude, spatial aptitude. Spatial means regarding space, means the assessment of the space or the distance. Organizational aptitude, physical aptitude, mechanical aptitude, STEM, that is science, technology, engineering, and mathematics aptitude. They call together, they have made a group of this STEM. And linguistic aptitudes. Few people, they are very good in languages. We have a language center in our brain, and if it is good, it is active, then that person, he can learn many languages. You may find some people that they can speak English very fluently than all other in their group. Few people, they can speak even the Sanskrit, and if they go to France, then they learn French very quickly, and if they stay in Assam, they learn very quickly Assamese language, or if they are in Kerala, they learn very quickly the Malayalam language. So this is linguistic aptitude is another very important aptitude. These are the general types of aptitude. Next. So career, these are the career options, because all these aptitudes which I have shown, how they are applicable to these career options after PG, that you have to find out, and that's why the last line, try to find out who you are based on your aptitude, whether you are good in teaching, whether you are a good researcher, whether you are a good practitioner, or whether you are a good entrepreneur, and many more things. As I mentioned, you may be a very good administrator, but before entering anywhere, please try to find out who you are, where you are going to succeed, where you are going to get the success naturally. So if you are in the same field, then there will be no stress. You will enjoy the things like anything. Next. Now let us see a difference between UG and PG education. This is to bring the clarity, because this you have already passed the UG and now you are in PG. So in UG, this syllabus is structured, timetable is very regular. There are different subjects like anatomy, physiology, swasthya in Ayurveda, or similar subjects. Different teachers to teach each subject, and many students in a classroom. You have a minimum 50 students, 60 students, or sometimes 100 students in your classroom, and examinations, etc. To give gentle judge from time to time. बार-बार परीक्षाएं होती रहती है for the judgment of your knowledge, for the judgment of your information. And total teaching hours per subject varies from 200 to 600 hours. That is what the normal, you can say, structure of UG education in Indian system of medicine. Next. Now in PG, a single subject to study, but single subject to study in depth. One or two teachers to teach, maximum 3 teachers, not more than that. Very few fellow students, not more than 10 or 12. Full 3 years for a single subject, because 3 years are devoted to a single subject. You have to study a single subject with all angles. Dissertation to understand how to do research. That is what I have earlier mentioned. Experience in scientific writing, presentations, and research publication, which is not there so intensively at UG education. Focus training. If you are in a Kaya Chikitsa and if your dissertation in Amavata, then there will be a focus training on Amavata along with the other subjects. Multidisciplinary exposure, because you are not only multidisciplinary, it could be transdisciplinary. And nowadays, many students, they are using molecular biology tools for their dissertation work. All are not going for the clinical trials, and a multidisciplinary type of exposure is there in good institutions and particularly in PG courses. More academic attention by the teacher. This is most important. They are not going to teach you every day, but what you are doing academically, how you are studying, all these things are monitored by the teacher. The study is intense. That is what is expected. If you are not doing, then please do make your study intense. And opportunities for specific specializations comes out of that. Study along with different people from different specialties. This is another peculiarity in post-graduation, because if you are doing some experiment outside your in outside lab, then you get an opportunity to meet the people over there, meet the students who are pursuing their PhD over there, and a totally different atmosphere for research, etc. Next. Now there are few difficulties we observe, and in NCISM we try to remove many of them. So these are the difficulties I have listed. You may find out some more, but that could be specific to your institution. No demarcation in UG and PG education was there, but now we have brought it very clearly. Now there will be a very clear demarcation in UG and PG education. As on today, there are no independent textbooks for PG, like in modern medicine or engineering or science subjects. There are independent textbooks for post-graduation that we are trying for. No clarity regarding specialty. That was there. But now, with this new regulation, this confusion will be removed in totality and legally. Difficulty in research questions and methodology. This is again our problem, because we are trained as a physician, and after 5.5 years, it is difficult for us, for many of us, to find out a totally different subject, which may not be directly clinical, or there could be, as I mentioned earlier, we may be in a position, we may not be in a position to find out which molecular biology tools are applicable to our subject, etc. Terminology used in education and research are different. This is a very peculiar problem of postgraduate education in Indian system of medicine. For example, in Ayurveda or Unani or Siddha, we are using a different type of terminology, like Vata Pitta Kapha or whatever the vizas and whatever the things are there. And here in research, we are talking about an anti-inflammatory, analgesic, or something like that terminology we are using. So the terminology used in education and terminology used in research, they are different. This is not there anywhere in other subjects. This is only our problem. And level of teaching and training that we have defined in this regulation. So this problem will also be sorted out from next year onwards. Next. Now, learning depends on ability to learn, that you have proved, you have cracked the examination. Learning environment, if you are in a good institution, then you get a very good learning environment. And readiness to learn, this is person specific. If you have a readiness to learn, then you can learn from each nook and corner of this world. Anywhere you can go and gain the knowledge, anywhere you can go and get the information. So out of these three, the last one, the readiness to learn, is most important factor, because all the other two factors, First, we have already established. Learning environment comes with your institution and the institution where you are doing your research and readiness to learn. That is, I am repeating it again. Next. Now, when we are learning, there are two things: sensations and perception. Next. Sensation is the process of receiving information from the environment through our sensory organs that you all know. Because when we look into a patient with our eye, we hear his complaint with ears, we touch him, we examine him with the help of stethoscope or with the help of whatever the case may be. So our sensations are active. But after getting the information from our sensation, perception is the process of interpreting and organizing the incoming information in order that we can understand it and react accordingly, because we have to diagnose, we have to understand something. So these are the two important components of learning. What is sensation and what is perception, that you must be in a position to differentiate. Normally we do that, but we don't think about it independently. And it is very, for example, we are walking and a stone comes in between. We simply avoid that and we go. That our senses, they understood that there is an obstacle and we may get hurt. And the perception is we find out the other way to go forward. So this is perception. This is a very crude example, but please try to understand so that it will help you to learn very nicely. Next. So this is where actually I told to the UG student also that when we talk about the aptitude, etc., this Prakruti and Yakshay, Ilakkanam and Mizaj, they are not only for the student, they are for us also. You must understand your Prakruti not only health point of view, even from the learning point of view, you must understand how in which field you are better learner. For example, because I am a student of Ayurveda, here I have given you these few examples that if you have a Vata predominance Prakriti, then you are good auditory learner. If you are a Pitta predominant Prakriti, then you are a kinesthetic learner. If you are a Kapha predominance Prakriti, then you are a more of a visual learner. So all these things you must understand that how if I am Vata predominant, then how I am learning, whether I am using more my eye, my ears, my tongue, my tactile senses or whatever the case may be, that you must understand and design your study accordingly. That's why this is in very short. This is actually in detail you must study and you must tell your juniors that know your Prakriti for study, not only for the health, or know your Yakkai Ilakkanam, or know your Nidar for study, not only for the patient or for the health. Next. These are the stages of learning. This is very important to understand at PG level, because unless and until you understand this properly, the level of learning you cannot identify or you cannot decide. For example, these are the four stages of learning. One is unconscious incompetence. Means what? I don't know what I don't know. How to do something. I don't know that I don't know how to do something. मुझे ये भी नहीं समझ रहा है कि मुझे ये समझ नहीं रहा. This is unconscious incompetence. मुझे समझ ही नहीं रहा कि मुझे समझ नहीं रहा. It's a very poor position of you can say learning. Then the stage 2 comes, that is conscious incompetence. I know that I don't know how to do something and it bothers me. मुझे ये मालूम है कि मुझे क्या नहीं मालूम और मुझे उसकी चिंता है. I am trying to learn that what I don't know exactly. ये इसको कहते हैं कॉन्शियस इनकॉम्पिटेंस। पहला अनकॉन्शियस इनकॉम्पिटेंस यानी मुझे ये भी नहीं मालूम कि मुझे क्या नहीं है। अब यहाँ कम से कम मुझे ये समझ रहा है कि मुझे क्या नहीं आता, और मुझे ये समझ रहा है कि ये क्या नहीं आता, एंड इट बॉदर्स मी, मैं उसकी चिंता भी करता हूँ। देयर इज ए कॉन्शियस कॉम्पिटेंस। आई नो दैट आई नो हाउ टू डू समथिंग। मैं तो ये तो सीख गया हूँ कि इसको इस चीज को करना कैसे है, एंड इट टेक्स एफर्ट, लेकिन मुझे उसके साथ मेहनत करनी पड़ती, प्रयास करने पड़ते हैं। दैट इज कॉन्शियस कॉम्पिटेंस। लेकिन दिस लास्ट स्टेज इज मोर इम्पोर्टेंट व्हेन यू विल बी ग्रेजुएट और व्हेन you will be in the field, then this unconscious competence is very important. I know how to do something and I rock at it. मुझे मालूम है ये कैसे करना है और मुझे बड़ा आनंद आता है। ये स्थिति जब आपकी लर्निंग की आती है ना, वो एक अपने आप में आनंद देने वाली स्थिति रहती है। आई ऑलवेज टॉक टू दी talk to the postgraduate students, and I always request them to find out that if you are doing something, whether you are enjoying it or not. If you are not enjoying it mentally, then because you must have heard from your IT friends that yes, I am working here in IT, but I got bored. It means he has not reached to unconscious competence. He is still in the conscious competence effort because he has to take efforts to do that, those things. And because of continuous effort, he got bored, he got tired, and he has so many. But if you have reached to this stage, then sky is the limit. वो पैसे वगैरह कितने मिलते ये तो कम ज्यादा होते रहता, बट यू ऑलवेज एंजॉय योर जॉब, यू ऑलवेज एंजॉय योर वर्क, यू ऑलवेज एंजॉय not only your study but everything which is going around you. So this unconscious competence is very important, that I know how to do something and I rock at it. Next, how to prevent forgetting, because in at UG level, in our medical education at UG level and at PG level, the volume of syllabus is very big, because we are dealing with a living being, a human being, and that's why the information, lot of information is there. So how to prevent forgetting? This is not only important from the examination point of view. It is important from the treatment point of view, from the teaching point of view, from the research point of view. So active interaction is the key word. If you are interacting actively with that subject, with a multiple context, not only a single context. If you are actively interacting with the subject with multiple contexts, then the possibility of forgetting reduces. It helps to prevent the forgetting. And practice and review. If you are doing something repeatedly, you are reviewing it continuously, then it helps you to prevent forgetting. बार बार उसी चीज को करना, बार बार उसकी चर्चा करना, अलग अलग एंगल से उसको देखना, और उसके साथ में उस विषय के साथ में संवाद करना, एक्चुअली एक्टिव इंटरेक्शन, ये अपने को दिस प्रिवेंट द फॉरगेटिंग एंड इट हेल्प्स टू रिटेन द इंफॉर्मेशन फॉर अ लॉन्ग टाइम, एंड इट कम्स अप wherever you want, whenever you want. That is the importance. That's why as a student this is very important. Next. Now this is Sarkar's advice for better retention of knowledge. मैं क्योंकि आयुर्वेद का विद्यार्थी हूँ, ये ऐसे एग्जाम्पल यू नहीं गेट इन यूनानी एंड सिद्धा also I am sure, because जितने भी ट्रेडिशनल मेडिसिन है, they have lot of such information and knowledge and anecdotes regarding how to study things, how to behave, how to have a ethical viewpoint of the life, etc., etc. So this is first one is nimitta. Any new topic needs to be given with sufficient reasoning. That is actually a nimitta. If you have chosen a topic, you have to give reasoning for that. You have to understand the reasoning for that. Then rupa grahana. This is visual method of teaching. This is from a shlok. Those who are Samhita students, they can immediately remember this slope. So we are using our eye, we are using our visual aid to visual method of teaching. Saviparyaya, using reverse example for teaching. Because many times if you are giving some example, then to understand it properly, then exactly opposite example may be useful many times. Sadhusha, using similar example. Now, both types, exactly opposite and similar. If you remember both types of example, then you will remember it for a longer time. Abhyasa, repeated practice. There is a very good definition of this abhyasa. Bhava, Besan, Abhyasa, Shilanam, Satata Kriya. Doing something repeatedly is abhyas, basically. And that's why this abhyasa is repeated practice. And Jnana Yoga, that is higher learning. As I told you that there is a concept of progressive unfoldment of knowledge. And for that, you have to go forward, 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 and forward. That is basically for the higher learning. And Unashruta. In those days, only hearing was the main. Even today, when we are hearing to our guru or our teacher, it means we are hearing, we are using our Karanendriya. So, Unashruta, re-hearing or re-learning, these are the Charaka's advice for better retention of the knowledge. These improves memorizing skill of the students. For this, you please remember the shloka, those who are from Ayurveda, and I request to Siddha and Unani student to find out such type of references from their books, so it will be easy for them to remember. Next. Now, this I was talking about. These are the peculiarities of Indian system of medicine. One is progressive unfoldment of knowledge. Just I have mentioned on the right side, there is a person on the red carpet, he is walking. And as soon as he reaches to that bundle, he can just push it and go forward. This is the Indian system of medicine, whether it is Ayurveda or Unani or Siddha or so on. But here on the left side, this is our existing system, this is Western system. 10वीं के बाद 11वीं, 11वीं के बाद 12वीं, 12वीं के बाद में first year, then second year, then graduation, then post graduation and PhD. Here you know the limit on the left side. Here on the right side, because this is progressive unfoldment, wherever you are stand, you are feeling contented. आपको समाधान रहता है कि मुझे इतना आ गया है. Here आपको समाधान नहीं रहता, कोई तो भी ऊपर दिखते रहता है. That is the difference between the perception. In Indian knowledge system, particularly in Ayurveda and even in Siddha, they use 4 words. One is Shastra, the other one is Tantra, the third one is Vidya, and fourth one is Kala. Similar words may be used in Unani also, I am not sure. I exactly don't know about it. But this is basically a structure of Indian knowledge system. So those who are from Ayurveda and Siddha, they will understand this quickly. First is Shastra. So what is exactly a Shastra is and how to teach the Shastra? This is very there is a peculiar way to teach the Shastra. And I will quote an example from the colophon of the Bhagavad Gita. Iti Srimad Bhagavad Gita Su Upanishadsu Brahma Vidyayam Yoga Shastra. Because in the Indian system, they always tell that whether it is Shastra, whether it is Tantra, whether it is Vidya, or whether it is Kala. So Yoga Shastra is Sri Krishna Arjuna Samvade. Means that is by dialogue. Sri Krishna is teaching by discussion because he is asking questions, Arjuna is asking questions, and Sri Krishna is replying to those answers. So that is by Samvada. So Sri Krishna Arjuna Samvade. So that is the way to teach Shastra. Then comes the Tantra. Tantra is Agnivesha Krute, Tantra, Charaka Prati Sanskrute. So this our Charaka Samhita and all Ayurvedic and Siddha, most of the texts they comes under Tantra. Some part of this Tantra they comes under Shastra also. So while teaching these things or learning these things, you must understand the difference between that. Tantra actually is to be taught. Here in Shastra, they were discussing. One was asking question, other was replying. But here in Tantra, you have to teach the skill because Tantra is skill based. Vidya is different than Tantra. Vidya is to be given. Like Dhanur Vidya is to be given by say Shankara to Arjuna or by Nadi Vidya. Nadi Vidya is given by a guru to someone else. And all art form. It could be surgery, or it could be violin playing, or it could be football playing. All types of kala, they come by samskara. Unless and until you stay with the guru for a long period, he is not teaching small things. Only you observe and you repeat it. That's why these four things, Shastra, Tantra, Vidya and Kala, you must understand the difference between how to study these. That's why in a small slide I have mentioned. Next. Now, there are two types of buddhis as per the Indian system of medicine. One is called Moolagrahi and other is called Pallavagrahi. Those who know Sanskrit, for them it is very clear. Moolagrahi is for improving understanding. That is going to the roots. And Pallavagrahi is for improving level of information. So, understanding and information, these are two things. Now, what we are getting from the chatbot or Google, it is Pallavagrahi. It is improving level of information. And it is not necessary that it improves your understanding. That's why these two types of buddhis they have mentioned. And you have to apply both in your PG education because some part you have to understand. Unless and otherwise you understand the thing, you cannot apply it. And at some places, you need a lot of information. So you have to apply both type of buddhis in PG education, Moolagrahi as well as Pallavagrahi. Next. This is knowledge pyramid. Nowadays, we talk about the data. And you are all aware, data is always of the past. Future का कोई data नहीं रहता. You have to, based on this data, you have to give your assessment or opinion. When this data is get organized, then it takes the form of the information. This is the difference between data and information. Data is, it is there that in your class of 100 students, 70 are girl and 30 are boy. This is data. But what is the information out of that? That more girl students are opting for Indian system of medicine or whatever the case may be. This is the information out of that data. So this is a very small example, very crude example. And when this information get analyzed for a long period, it converts into the knowledge. Means information plus experience lead to the knowledge. Information plus experience lead to the knowledge, and again knowledge with experience turns into wisdom. So it takes long time. So from data to information, it takes not much time, but from information onward, going to knowledge level, going to wisdom level, it takes a lot of time. So my request to PG student is whenever you are using these words, ये जो बंदा है ना उसको बहुत knowledge है, so make it clear whether he is having a knowledge or information or he is having only data. Wisdom comes in very later stage. So that's why you must understand this knowledge pyramid and the time taken to change the stages of these four stages, one after the other. And this you must always remember during your study also that the information whether which you have received is truly an information or it is a data. So this basic difference between understanding, this basic difference of understanding, you must understand with the use of this pyramid. This only I want to convey it to you. Next. These are few suggestions for you, my friends. Try to find out the area where you can go deep. It is not only related for this, it is not only applicable for your 3 years program. No. Even after that, you can continue, whether you can continue with that subject and go into deeper and deeper and deeper, because it gives you the immense pleasure as a बहुत मजा आती है उसमें. Those who are there, they are enjoying their life like anything. They are making their bread and butter with whatever means they are. Some are practicing, some are teachers, some are researchers, whatever. But when they start going deep and deep, they have a different level of pleasure. So my request, my suggestion to you is try to find out the area where you can go deep. Try to find out the area for more information. Again, Pallavagarai Buddhi, because we are living in the area, in the era of information. Information के जमाने में हम रहते हैं तो information तो चाहिए. Indian system of medicine is holistic one. Connect the dots and create a picture. This is most important because many times we go with a particular diagnosis, which is basically with a Western setup. But we, at the same time, we lose many things. So try to keep the understanding of your subject and your patient holistic, both, and connect the dots and created a picture. That also you will excel surely in that in your practice. Try to find out new manuscripts on your subject, because new manuscripts means not only new books, even old manuscripts, they have a lot of information in it. So try to find out the old books. Go once for, because many times what happened, a chapter or a paragraph or even a single shloka is very important in this today's context. So that's why please try to find out the relevant research papers. That is, again, you are anyway, Google search is going on. So please don't waste much time on just seeing what is going on in this picture and that picture. Podcast, very good podcast are there. Just now I saw a podcast on Charaka Samhita. It was a very good podcast on education, on different type of research, on artificial intelligence, because it is at our doorstep. So this is very important, and that's why I wrote here to others. Means not only our friends, not only our teachers, those who are giving lectures on this, please go to conferences, please hear to the other people. Many times, my experience is in whole conference of 2 days, we find only 1 or 2 very good speeches which enriches our understanding of the subject. But it doesn't mean that everything is bogus. You get pearls in the मोती कब मिलते हैं? कबीर ने कहा है कि जिन खोजा तीन पानियां गहरे पानी पे, जिसने ढूंढे उसको मिले गहरे पानी में के मोती. जो काट पर बैठा रहा उसको कुछ नहीं मिलता, कभी ना कभी तो डुबकी लगानी ही पड़ती है. तो ये गहरे मोती मिलने के लिए जिन खोजा तीन पानियां गहरे पानी पे, मैं बपूरा डूब रहा किनारे पे. So try to go to deep, hear to others, make others to hear. हम लोगों ने इतना लॉजिकल और इतना अच्छा और इतना नया बोलना चाहिए कि people should stay to hear to you. that ये बंदा कुछ नया बोलता है, ये बंदा कुछ out of box thinking करता है. It comes with the अध्ययन. So make others to hear. That is my suggestion to you. Right? Thank you and best luck, because now you are going to become a specialist in a subject, and whether you may be in first year, second year or final year, my best luck and best wishes with you. And thank you very much. Namaskar, Dhanyavad. Thank you to all our technical team who are taking various efforts to make this visible and audible to all, because in this online system we need support from many technical people. And thank you to our Pushpendra ji. Very good slide presentation from his side. Namaskar, Dhanyavad.
Thank you very much, sir, for your elaborative and knowledgeable deliberation. I am thankful to all the members who have joined this online meeting, and particularly the chairperson, sir, Jayendra Pujari, all the presidents and the members of the commission who have joined this. So thank you one and all.